So I have the pleasure of presenting our next presenter. Many of us already know her. She's one of our good friends. This is Mrs. Judy Neville. Miss Judy has led the AAPT for the past 7 years, and she is also Director of Pharmacy of Technician Educators at the University of Nebraska. And I know that she has many other job titles and has many other roles, so I will let her continue with that. And Judy, I appreciate you coming on up.
Thank you, Marcy, for the introduction. Marcy has held the position of president of AAPT in the past, and she continues to be a great supporter. I did just want to say a couple of things before I start. I want to thank Donnie for your wonderful blessing. Thank you for that. I did ask our McKimmon staff to bring in 2 more tables. And so thank you for doing that. And you're welcome to, if you want to space out a little bit more, pull your chair over, but you'll see there's a couple more tables over here to the right, just to make things maybe a little bit more comfortable for us. So, okay. Well, my topic came to me from a respondent of a survey from convention last year. And the respondent commented that there were topics about advanced practices, but how do we get a job working in a pharmacy that offers advanced practices? So really, my presentation focuses on the skills maybe that you need, but more about the soft skills, less about technical, more about soft skills. Presentation is about probably doing some reflection on where you're at in your own career and where you want to be. So if we can just take a look maybe at where we're at right now with our job satisfaction, where do we feel we're at? And the reason I entitled it Journey is because I really feel like our career is a journey. It's something that isn't a 2-year, it isn't a 5-year, it's maybe a lifelong journey. And if we can relate it to maybe a vacation that we go on, or maybe where we choose to be in our life, we think we want to be in one place and we get there and we decide maybe this isn't really where we want to be. Maybe we want to be over here instead. And so really today it's about kind of doing some reflection. I have some practical tips and maybe some more things that are thought-provoking. So the data that I have here comes from a very recent survey that was published this summer at ASHP meetings, where pharmacy technicians were surveyed. About 260 pharmacy technicians responded to the survey. The majority of these technicians worked in an inpatient hospital setting. And surprising to some of us, and maybe not so surprising to some of us, of those technicians surveyed, 40% said that in 3 years, I do not plan to be a technician any longer. That's a big number. 40% of technicians said, in 3 years, I'm getting out of this profession. And the reason given was because of lack of advancement opportunities and pay. And so along that same line, there was a different survey that Drug Topics published, different survey, but about the same topic. And not surprising to me, of the 40% who said, we're not even going to be in this profession in 3 years because we're not able to advance, we don't have the pay we want, and really honestly the pay we need, 92% still have a passion for their work. I think that really is an accurate picture of pharmacy technicians. And I wonder if pharmacy technicians fit into something that's a category called an enthusiastic stayer. So I live and work in Omaha, and there's a kind of famous gentleman also from the Omaha area. You may have heard of him, Warren Buffett. And so Warren Buffett, I cannot call him a friend, but I think most of us know who he is. He's, I think, the fifth richest person, a billionaire. So he recently had an interview where he reflected on his work history. He started out in his grandfather's grocery store, and then he reflected, or he talked about the current work environment. And he said there are individuals in the work environment who are, he termed, enthusiastic stayers. They are people who are assigned boring tasks and they're paid very little. And these are the same people who make up about 33% of our workforce, and they're the people who really are making the businesses profitable. I think that many pharmacy technician roles fit into that enthusiastic stayer classification. So let's talk about out-of-the-box job opportunities for pharmacy technicians. Dr. Klepser kind of mentioned one earlier, a pharmacy owner. And now that's what I consider an out-of-the-box position for a pharmacy technician. Any other thoughts of out-of-the-box positions or roles for pharmacy technicians? Say that again. Auditors, I agree. And I have a $5 off lunch gift card for you, Gail. You got to come up and get it, though. Pharmacy auditor, I agree. That's an out-of-the-box position. A prior authorization coordinator, another out-of-the-box opportunity. How about another one? Something that you don't hear of very often, and just as pharmacy owner, I think that we are conditioned when we hear pharmacy owner, that's a pharmacist. That's what we're conditioned to think, but it's just not true. It doesn't have to be true.
Well, I met somebody that I thought had a fascinating job. She was a pharmacy technician who was a trainer for BDK. So her job was to travel to any hospital that was updating their IV systems to BDK and train those technicians and make sure the software and systems were installed correctly and then move on to the next facility.
Okay.
She was out of Wilmington, North Carolina. I thought that was fascinating.
That's great. So in the audience, one of the out-of-the-box job or roles for technician is someone who trains, travels to different hospitals where they're initiating a new IV system and trains probably the nursing staff on administration of those IV systems and maybe the pharmacy staff on setting them up. Here you go. Thank you for that. Okay, so we talk about these different out-of-the-box positions. We talk about advancement. Who can tell me what they think is the one skill that we all have to succeed? And maybe a more accurate way to put this is something that we have to move ahead. What's that one skill? What did you say? Flexibility. And Chris, what did you say? Audacity. So far, it's not what I'm looking for. I'm not saying they're not right, just not what I'm looking for. Integrity, I heard, and I heard someone over here say communication. So that's the ding, ding, ding. Communication is what I'm looking for. You know, some of us might think communication, that we've heard so much of it, it's overrated. But where I want to kind of press forward with my topic presentation is that communication is key. I really think if there's one thing that you could walk away with today from my presentation and walk away at the end of the day is that this one little thing that we hear a lot about, the one little thing, communication, it swings big doors. It really, really does. It's about the way we come to the way we come to the table. It's about the way, we present ourselves. It's about our inflection. It's about the words we choose to use. And communication is really a big deal. So I know we're all aware of the soft skills. And just as a reminder, those soft skills are the skills that I call transferable skills. They're not the technical skills. They're not, this is how we, compound an IV. The soft skills are the skills that are really part of us. They're part of us in our personal life, in our work life, and they're really obviously very important skills. So one of my hints for you is to start building your personal brand. And so when I say your personal brand, that's about you and your professional life. It's about you personally. And so identify 3 things that you want people to know about you. And this is where I think it's just a little bit of reflection. What do I really want people to know about me? And so this is something, if you love where you work right now and you see those advanced opportunities and you see where your environment supports you and you have the opportunity for maybe some out-of-the-box role as a pharmacy technician, what do I want my current employer to see about me? Think about those 3 things. And those 3 things, it could be about how do you solve problems? How are you best at solving problems? It could be about, what are your strengths? It could be about what's been a big win for you? What are you most proud of? And so reflect on that and kind of come up with your own type of elevator pitch. Hi, I'm Judy Neville, and I've written 3 textbooks for pharmacy technicians because that is my passion. What you want people to know about you should really be about your passion. So when you increase your ability to communicate in one area of your life, you're really going to put forth in many areas. Recently at the Med Center, one thing I like about working at the Med Center is that there's kind of a joke, but it's a true joke, that you can get a free lunch every single day. All you have to do is attend a symposium or a seminar. There's always something going on for self-improvement or work improvement. And recently I attended something where the description was kind of learn how to think on your feet better, learn how to react to situations better. And really what it was an improv class. And so what I learned there is whatever someone gives you, don't ever say no, say yes and live in their fantasy world with them. If it is kind of a fantasy world, but how you really are able to be more dynamic and kind of think on your feet is yes and then you roll with that. And I did that at work, and it really helped me in my personal life too. So now let's just talk about some things to help you advance in your career, both personally and professionally. So just some things that you might want to kind of reflect on. I think it's good when I reflect, I make some notes. What do you like or dislike about your current job? What do you really need to feel more fulfilled? What do you truly need to feel more fulfilled? And what skills could you take in your career that you really like right now and take them to the next level? And then we've had some people, and I know we do have educators in the audience today, and so much of the time that takes just a little bit of push, a little bit of that education to really bring that up a level. How much do you want to earn? How much do you need to earn? How much do you want? And what are your strengths that you can take to the next job? So am I a good? When we're doing some self-reflection, am I really good? Am I someone who can get that job that I really never thought I could get? So these are some questions that I kind of came up with to maybe ask yourself. Have I received feedback that stings? You are looking at someone who's received really negative feedback, and it hurts. It really hurts my feelings. And for anyone that says don't take it personally, you take it personally. You do, especially when what you're doing is your passion. But I'll tell you what, all of that negative feedback has improved how I perform. It's improved, it's improved how I react. It's improved me. If I were going to get feedback every single time, and trust me, I would not, that said, you're doing great, Judy, I can't learn from that. How I've learned the most and how I've improved the most is from that feedback that kind of stings. And so if you're someone who's received that feedback, you're someone that is on that trail to top talent or already there, because then you've reflected and you've made improvements. Have you had a strong win at work? Have you had something that has been a positive improvement for the pharmacy you work for? Has it been a positive improvement for the patients? Have you had a really strong win? Have you kind of gone to the line and made a difference? And sometimes those differences are little things, but they make a big difference. What I mean by well-aimed applications, If you are an individual who is seeking a position where you will feel more fulfilled, where you will feel more respected, where you will feel that your talents are being used, what I advise here is do not do blanket applications. Research where you're applying. Research that company and find out if it is a really good fit for you. I know many people will apply. Trust me, right now I am searching for a secretary to help me. And I wonder why this individual who has worked at Maurice's is applying to help me with pharmacy education. And never been a pharmacy technician. I still interview because I am curious, why? Because there may be a connection, maybe, mom or dad, maybe there's pharmacists in the family. But what I mean by applications is really invest the time in looking at that company before you apply. Do your goals in your personal life, are they connected with your job? Are they really life goals? Are they connected? I think when they're connected, it means that you're really doing what you want to do. It's part of your life. Have you worked through it without quitting? When you work through something, when something comes up, and it comes up for all of us, it doesn't matter what level we're at, it doesn't matter where we work or how seasoned we are, stuff comes up. And have you worked through that stuff and not quit? Because that shows resilience, and resilience is what the employers are looking for. Resilience means you are top talent. It means you are working through those things. This is what happened to me. This is what I planned to do. This is what I did. It didn't turn out the way I wanted it to, and this is how I kind of moved through it. That shows resilience. That's something that I think is part of top talent. So now let me talk just real briefly about practical tips. So what makes you stand out to the recruiter? I don't know if this had anything to do. My daughter's over there, and she is just starting a new position August 1st at, I will say, probably her dream job. And she showed me the posting for the position. She said, "Mom, here's my resume." And I said, "Megan, do this, do this, do that." And what I said to her is, this is what they're looking for specifically on the description. So you have to show this on your resume. And so matching that resume to what they're looking for, that's the first thing the recruiter looks for. I think it's like 3 minutes. The recruiter is a yes or a no with your resume or your application. Match your talents to what they're looking for. So for example, if you have never worked at a 340B entity, but that's something that interests you, but you have no experience in 340B, maybe you've attended a 340B continuing education topic. Get that on your resume. Anything where you can show some type of matching, that's what the recruiter will look at. So that's a practical tip. Sometimes people wonder what the difference is between a CV and a resume. So I just thought I'd briefly touch on this. So a resume is something that maybe most of us are more familiar with, and it's kind of a chronological document that we developed that shows from June of 2010 to July of 2015, I worked here. And then from 2015 to 20, I worked here. How a CV is different is that it lists your accomplishments. So if you're someone who has written some articles that were published, if you've won some awards, if you present at things like this, any type of accomplishment like that, you should get that onto a CV. A CV is something that lists your accomplishments. That's how it's a little bit different. Another thing that you might want to have in your back pocket is a letter of recommendation draft that you will hand, and I say hand because it would be electronically, hand off to an individual and say, "Hey, could you fill in the blanks for me, and will you recommend me for this position?" So how tough is it to say, "Hey, Boss Tom, will you write me a letter of recommendation? I need to have it in 2 days." And Boss Tom doesn't really like having that ask, and it's hard for Boss Tom to do that. But when you have this formatted and ready to go, 100% of the time, they will fill in the blanks and get it back to you. So kind of a neat thing to have in your back pocket. Another practical tip, what I mean by this develop relationships at all levels, is that I think maybe we tend to have our peers be at our same level, other fellow technicians, but please be sure to have relationships with your boss. And some people are the other way around. They only want relationships with their boss because the boss is the one who gives the raise, the boss is the one who does the scheduling. But have relationships at every level with your pharmacy owner, with the managers, with the schedulers, with the individuals who order the products. Have those relationships across the board. So a quick story here to just remember that everybody has a differing point of view. Me as a convention organizer versus you as attendees, you have a different point of view. I know you do, and I want to hear about your point of view, and we'll survey you. And we're not surveying you just to survey you. We really want to know. People have different points of view. And keep that in mind when you are working through, do I want a different job? What's going on right now? How can this person treat me this way? Different points of view. So a couple of weeks ago, I had one of my grandsons for the day. He's 7 years old, although during that day he was 10 because he wanted to ride the horse by himself. So he had to be 10 years old, although he is 7. And it was toward the end of our time together. He was in the back seat of the car, and I was taking him back to his mom. And I said, Croy, I handed him my cell phone. We're driving on the interstate, and I said, Croy, text your mom and tell her we're on our way. And he knew how to get the texting app up on my phone, 7 years old. He knew how to do the text. He knew how to talk into it, do the text. And he said, how do I send this? And I said, hit the arrow. He said, where's the arrow? And I said, hit the arrow. It's right there by the text message. I don't see an arrow. Where's the arrow? Let me see the phone. So I'm driving on the interstate, and I said, it's right there, Croy. Hit the arrow. It's right there. And he said, okay, you mean the paper airplane? And it makes sense, doesn't it? And that was his point of view. My arrow was his paper airplane, and it was the same thing. So I think that point of view is so important. Ask for help, and asking for help is something that will help you navigate relationships at every level. I used to tell my daughters when they were in elementary school and junior high, compliment someone today, and that'll help you build a relationship. I think in the workforce, asking for help is what helps build that relationship. So don't be afraid to ask for help. I hate to say this is outdated career advice, but it is outdated career advice. I like to say that some of these things never change, but guess what? They change. Your cover letter doesn't have to be as formal. It doesn't have to be dear sir, dear madam. It can be less formal and more fit the opportunity. Some applications won't ask for a cover letter. You should still get one in there, and it can be less formal. Job hopping is okay. It used to be that if you were at your career for 25 years, that meant you were the best employee. It's okay to job hop, because now what it shows is that you have experience from this many different places. Now, potential employers want to see that there was direction with that job hopping, but job hopping is okay. You can talk about your weaknesses. When you talk about your weaknesses, for example, in a interview, it shows your resilience. Hey, this came up at the job I'm at, and this is how I handled it. It shows that you're able to work through the problems. And it used to be stay off social media, but guess what? Now most of the employers advertise their jobs on social media. So certainly watch what you're posting, watch what pictures you have on there. But it used to be, don't be on social media if you want to get a job. But now that's how we hear about the job. So a little bit of outdated advice, that might help us when we're out there looking. So another kind of recent survey when we're talking about salary. Now I'm one of the biggies who is in the corner of pharmacy technicians are not paid enough. I don't care what anyone wants to say. I don't care what battle the big pharmacies want to put in place. Technicians are not paid enough. So this is a survey that talks about pay. And what we're looking at here on the left side, and this is from, you can see the U.S. Bureau of Labor and Statistics. On the left-hand side, it kind of categorizes the different types of pharmacies. And at the bottom in blue bold shows the highest paid technicians are those who are working in the inpatient pharmacy. And so it shows the hourly wage. Now, although that's the highest paid, that's the least amount or fewest in the segment of pharmacy technicians work in the inpatient pharmacy. So the salary, and then if you go to the top right, it shows technician 1, 2, 3, and 4. In this case, it's saying that the tech 1 is, or I'm sorry, the tech 4 is the highest level. I've seen it the other way around, where a technician 1 is the most advanced, but this shows technician 4 is the most advanced. So you're looking at different types of pay here. But what I want to say is look for a position not based on pay alone. So here are some other things to look for. Better benefits. I've always said this as I work with technicians. There's a big benefit to a job that maybe pays $2 less an hour, but you can work from 9 to 3. So you can take your kids to school and drop them off. You can be done at 3 and pick your kids up from school. Huge benefit. So, of course, we're looking at things above and beyond the pay. Better title. When you're looking at what you need, what you need to feel more fulfilled, maybe you've always wanted to be called an associate director. Maybe you've always wanted the title of a manager. And if that means something to you, then that's something that you look for above a job, above the pay that you're getting. And then just better work. If you're doing what you actually want to do, that's definitely something to look for. So this is kind of, I'm a big list maker. Huge list maker. And so this is kind of what I developed. If I'm looking for a job, what must I have? What are my must-haves? At this new job, I am not going to work weekends, so it must be a Monday through Friday, for example. What's nice to have? Hey, it'd be nice if this were within 2 miles of where I live. Kind of make this up, and you might surprise yourself. You just might surprise yourself and didn't realize that you had such a strong desire for a title. That there really was nothing else in your must-haves but that title of manager. So with this, this is not about pharmacy technicians. This is about the workforce overall, and what made people leave their jobs this past year. And again, at the top, we have low pay, no opportunities. And again, this was not just technicians. This was all over workforce survey. And I just wanted to talk a little bit about feeling disrespected at work. Can I see a show of hands if you at times feel disrespected in what you do? Yeah, I know it's all over the place. So I just wanted to talk about that for a little bit. So I read this article, guess what, because I feel that way too. So that's why I was reading an article on it. 11 tips to get more respect at work. I think the article had maybe 44 tips, and I pulled these from it. I have them in 2 different boxes because one I felt is really more about our soft skills, and the other is a little bit more actionable items. So smiling more. And these are things, again, that I pulled from the article that I truly believe. And so that's why I'm sharing them. Smiling more will get you more respect. Listen better and just actively listen. Strengthen your voice. Walk around and say hello. And I almost didn't put that in there because I thought these guys are going to laugh at me because many of them work in a pharmacy where there is no walking around because the pharmacy is so small. But what I thought is even if you get out from behind the counter and walk around up front and say hello to your patients, that shows something there too. Of course, we all know about making eye contact. Use powerful and inspiring words instead of sure and yep. Instead of saying that, how about if you would say amazing? Did you have a great convention? Or did you have a good convention? Yep. Or how about if you say, it was amazing? Those word choices make a difference, right? Definitely help others. Invite someone to lunch. Do it. I try and do it. I would love to do it once a month. So that's 12 lunches a year. It's not much. It's even hard to do it once a month, but make it a goal. Make a difference. Know your stuff. You know, nothing gets you more respect than when you really know your stuff. Tell a story. Sharing stories helps people get to know you better, telling a story. And then, I don't know why I put dress better in there, because everybody looks fantastic today, but I had something on my brain when I put that in there. So back to my friend, Warren Buffett. 91-year-old, what do I have here? He's the 5th richest person, and he has a net worth of $115 billion. So back to my friend Warren, this is what he says, and I truly believe in it. Seek personal fulfillment over money. Pursue a job that you actually enjoy in a workplace with talented people who you actively admire. You have to be around people who are, you know, who you feel are role models to you. Seek employment in a field, seek employment in a place, in an environment where if you didn't have to have the money, you would still choose to work there. And really what I think to kind of my advice is when you're looking at where you're at in your career and where you want to be, do not compare yourself to anyone else. Never do that. You have your goals and you compare yourself to yourself. Hey, in a couple of years, this is where I want to be. A couple of years ago, I wanted to be here, and here's where I'm at, and here's what I did right. Do not do any of that comparing to anybody else. Just do it with yourself, right? I always do my best to get pictures of my grandkids in my presentations somehow. And so that's one of my granddaughters, and the shirtless boy is a grandson. But really my best advice to you is just to know your value. I think that you will know that even more and be abundantly aware of it when you leave this convention over the weekend, because every presenter will talk about how could I ever do my job if it weren't for the technicians, and know your value, you know, as an individual beyond being a technician. What you do for people. I tell my students, I am doing this because pharmacy is a small world. It's a small community, and I know that one of you will touch my life personally. You will dispense meds to my mom, to one of my grandkids, and you better do it right. And so that's why I'm here educating you today. So I'm open for questions, but that's all I've got for you, folks. Thank you. Mr. Shackelford has a question or comment.
I just had a comment about the first thing you talked about. When I first got married, I'd already been working as a pharmacy tech for a couple of years. And so my wife asked me if this is what I was going to continue to do, or did I have other ideas? And I said, well, I think probably 2 to 3 years. I recently retired after 45 years.
I love that. So Fred Shackelford said that when he first started working as a technician, he got married and he had been working as a tech, and his wife said, "Is this something you plan to keep doing?" And he said, "Oh, I'll probably do it for 2 to 3 years, and then I'll move into something else." Well, Fred, after 45 years of being a pharmacy technician, just retired when he initially thought he would leave the field. So, good story. Thanks for telling your story. Thank you.